Welcome to the lecture on child, older adult, and intimate partner violence. There is no place like home, but for some children, adults, and elders, the home is a dangerous place where family members or intimate partners demonstrate disregard for the rights of others. Family violence, also known as domestic violence, is the most important public health issue in the United States. Objectives of the chapter include identify the nature and scope of family violence and factors contributing to its occurrence, identify 3 indicators of physical abuse, sexual abuse, neglect, and emotional abuse, describe risk factors for both victimization and perpetration of family violence. Let's take a look at this case study. A 12-year-old boy, Adam, is admitted to the emergency department with a broken wrist, a swollen eye, and fractured radius. His parents seem very anxious, and the father seems particularly on edge. When you, as the attending nurse, ask what happened, the mother immediately says, skateboard accident. Adam looks up to her quickly, and she smiles at him and says anxiously, honey, we've told you to be more careful on that thing, right? She has tears in her eyes and breaks eye contact, raising a shaking hand to her mouth. Let's look at the types of abuse. Physical abuse. Physical abuse is the infliction of physical pain or bodily harm, such as slapping, punching, hitting, choking, pushing, restraining, biting, throwing, and burning. Sexual abuse is any form of sexual contact or exposure without consent, or in circumstances in which the victim is incapable of giving a consent. Sexual abuse is also referred to as sexual assault or rape. Emotional abuse is undermining of a person's self-worth. This may include constant criticism, humiliating, diminishing one's abilities, name-calling, intimidating, isolating, and damaging relationships with others. Neglect is a failure to provide for physical, emotional, educational, and medical needs. Economic abuse is controlling a person's access to economic resources, making an individual financially dependent. Forbidding school attendance or employment keeps a person dependent. So these are various types of abuse. Legal definitions of family and domestic violence vary from state to state. Looking at the epidemiology and comorbidity, nearly half of all Americans have experienced violence in their families. In 2014, there were 3.6 million referrals for child abuse and neglect. The most common form of abuse was neglect, followed by physical abuse and sexual abuse. It might take the form of act of commission or act of omission. Act of commission are some things we do deliberately or intentional, such as physical, sexual, and emotional abuse. Acts of omission or neglect is the one in which the child's basic physical, emotional, or educational needs are not met, or when a child is not protected from harm. It may include physical neglect, emotional neglect, medical and dental neglect, educational neglect, inadequate supervision, and exposure to violence. Girls are slightly more likely to be abused and make up 51% of the victims. The most sad is about 92% of child abuse perpetrators are the victim's parents. Females are somewhat more likely to abuse children. Women make up 51% of the perpetrators. What are some comorbidities that occur with abuse? The secondary effects of abuse include anxiety, depression, suicidal ideation, Major depressive disorder and post-traumatic stress disorder are two of the most prevalent disorders resulting from childhood trauma. Women who are victims of prolonged sexual abuse are more likely to develop major psychiatric distress, more incidents of borderline personality disorders and major depressive disorder in women who had a history of childhood sexual abuse. Looking back at the case study, 12-year-old Adam is taken for X-ray, imaging of his hand and forearm. The attending physician sends his parents to the waiting room, though the father in particular is reluctant to leave his son's side and becomes mildly agitated. You can see him again soon, the physician occurs, but not in radiology. Reluctantly, the father cooperates. You don't have to bug the kid about his skateboarding, okay? Last thing he needs is questions. He never can think straight on a normal day when he is badgered, let alone when he is hurt. He's in a class for mildly retardeds. Understood, the doctor nods. Alone with you, the physician says quietly. That's Dad's a little on the angry side, more tense than worried, I think. See what you can find out while I buy you some time. You as a nurse agree. Let's look at the occurrence of violence. It requires a perpetrator, a vulnerable person, and it makes up a crisis situation. Crisis situation is a situation that puts stress on a family with a violent member. A person with effective impulse control, problem-solving skills, and a healthy support system is less likely to resort to violence. Social isolation caused by frequent moves or inability to make friends contributes to ineffective coping during the crisis situations. And then we need the perpetrator. Perpetrator is the member of a household who is violent toward another member. The vulnerable person or the victim or the survivor is the family member upon which the abuse is perpetrated. Using the term survivor recognizes the recovery and healing process that follows victimization. What are some characteristics of perpetrators? They consider their own need more important than needs of others. They have poor social skills. They have extreme pathological jealousy and may control family finances. What are some characteristics of abusive parents? A history of abuse, neglect, or emotional deprivation as a child. Family authoritarianism, low self-esteem, poor coping skills, social isolation, unrealistic expectation of child's behavior, frequent use of harsh punishment, history of severe mental illness, violent temper outburst, inability to seek help from others, perception of the child as bad or evil, history of drug or alcohol abuse, feeling of little or no control over life, low tolerance for frustration, and poor impulse control. Let's look at the cycle of violence. Walker in 1979 describes a pattern of behavior that perpetrators of violence may use to control their partners. This cycle consists of 3 stages: the tension building stage, the acute battering stage, and the honeymoon stage. So the tension building stage begins with minor incidents such as pushing, shoving, verbal abuse. During the tension building phase, the abuser is edgy, has minor explosions, may become verbally abusive with minor hitting, slapping, and other incidents may begin. The victim here feels tense and afraid, feels like walking on eggshells, feels helpless, becomes compliant, and accepts blame. Here the victim may try to reduce the tension by minimizing the importance of incidents. He says, I should have had the house neater and dinner ready. That's the tension building phase. Next is the acute battering stage, or the serious battering phase. It includes serious battering incident The tension becomes unbearable. The victim may provoke an incident to get it over with. The victim may try to cover up the injury or may look for help. After the abuse occurs, the abuser and victim endures a period of calm known as the honeymoon stage. During this stage, the abuser usually demonstrates kindness and loving behaviors, such as bringing gifts and flowers and doing special things for the victim. They make promises to change. They feel sorry. So all the legal proceedings or plans to leave initiated during the acute battering stage may be abandoned at this phase. The victim is trusting, is hoping for change, and wants to believe partner's promises. But this phase continues. Unfortunately, without intervention, the cycle repeats itself. Over time, the periods of calmness and safety becomes briefer, and periods of anger and fear are more intense. Each repeat of the pattern erodes the victim's self-esteem. The victim either believes the violence was deserved or accepts the blame for it, and this can lead to feelings of depression, hopelessness, immobilization, and self-deprecation in the victim. So there is a cycle of violence. It starts with tension building phase, acute battering stage, and the honeymoon stage. And without proper intervention, this phase continues. Mentioned earlier, the cycle of violence. Tension building phase, the serious battering phase, and the honeymoon phase. So in the tension building phase, the abuser has minor explosions, may become verbally abusive with minor hitting. The victim feels tense and afraid. Then it leads to serious battering phase, here where the tension peaks, and it is usually triggered by an external event or by the abuser's emotional state. The tension becomes unbearable, and the victim may provoke an incident to get it over with. After this phase comes the honeymoon phase, where the abuser tries to undo what they did. But if without proper intervention, this phase would continue. Let's look at some characteristics of vulnerable persons. Children, women, and elderly are most vulnerable towards violence. As we saw earlier, girls are slightly more likely to be abused and make up 51% of the victims. Sexual abuse increases with age. By age 17, sexual abuse and sexual assault occur in nearly 27% of all girls and about 5% of all boys. Adults are responsible for these cases of abuse and assault about 11% of the time for girls and about 2% for boys. Pregnancy may trigger or increase violence. Children who are younger than 4 years of age are most likely to be abused. Violence may escalate when wife makes move towards independence in case of intimate partner violence. Greatest risk for violence when the woman attempts to leave the relationship. Recently, one of my juniors succumbed to death. Her husband stabbed her about 14 times or more and drove the car on the top of her. It happened in Florida. She was trying to leave him and move independently to her parents, to her uncle's house, and then she was killed. Such a sad story. They had a really young kid, about 1.5 years old, when the police came to take her to the hospital. The only thing she said was, I have a kid, I have a 2-year-old, I want to survive. That's what she said, but she did not make it. She was killed. What are characteristics of one in case of children younger than 3 to 4 years, perceived as different, remind parents of someone they do not like, product of an unwanted pregnancy, the interference with emotional bonding between parent and child, because of a premature birth or prolonged illness requiring hospitalization. This has found to increase the risk for future abuse. In case of older adults, poor mental or physical health, dependent on perpetrator, female older than 75 years, usually white, living with a relative, elderly father, cared for by a daughter he abused as a child, elderly woman cared for by a husband who has abused her in the past. These are some characteristics of vulnerable person as older adults. So recalling the father's behavior and some common perpetrator and victim characteristics, which might you cite as the most likely indication that the father is possibly a perpetrator? His description of his family needs, his insistence on being the one to provide financial information, his disdain for skateboards, his description of his son's learning disability. His description of his son's learning disability. Now, coming on to the nursing process. First, we have to do a general assessment. You will encounter victims of violence in every healthcare setting. Therefore, you should screen all patients for possible abuse. Some symptoms may be vague and can include chronic pain, insomnia, hyperventilation, or gynecological problems. But all assessments should include questions to elicit a history of sexual abuse, family violence, and a drug use or abuse. Any assessment should be completed with the victim alone, and is helpful to have an institutional policy that facilitates screening in private. What are some objectives for nursing process? Describe 4 areas to assess when interviewing a person who has experienced abuse. Identify 2 common emotional responses the nurse might experience when faced with a person subjected to abuse. Formulate 4 nursing diagnoses for the survivor of abuse and list supporting data from the assessment. Looking back at the case study, along with Adam, you say, "You know my little brother falls off his skateboard a lot. What kind of board do you have?" Adam looks panicky at the question for a moment, then shrugs and says, "I don't know." You try again. "Jason has one of those ones with a ninja painted on it. Do you that kind?" "I don't know," Adam says. "Maybe." In general assessment, you screen all your patients for possible abuse, because you might encounter victims of violence in every healthcare setting. The interview process and setting: conduct the interview in private, be direct, honest, and professional. Use the language the patient understands. Ask the patient to clarify words not understood. Be understanding. Be attentive. Inform the patient if you must make a referral to children's or adult protective services, and explain the process. Assess safety and help reduce danger at discharge. Establishing trust is crucial. If the patient is comfortable enough to self-disclose, patient would share information. The person who experienced the violence should be allowed to tell the story without interruption. Reassure the patient that he or she did nothing wrong. And do a self-assessment to see how comfortable you are to ask such questions. Alone for a moment with Adam's parents, which secondary question is least appropriate to ask at this time? How do you discipline Adam? Who helps you to take care of his special needs? What about Adam's behavior bothers you the most? What did you do to this child? Least appropriate would be the D. What did you do to this child? Some questions which can be less threatening and which can elicit more relevant informations are: what arrangements do you make when you have to leave your child alone? How do you discipline your child? When your infant cries for a long time, how do you get him or her to stop? What about your child's behavior bothers you the most? These questions may sound less threatening and elicit more relevant informations. What is others few assessment tools that can be utilized to assess intimate partner abuse? The figure 28.2 shows an abuse assessment screen. There are about 5 questions that we can utilize to screen for abuse. In assessment, you look for types of violence, indications of violence. It may be physical abuse, sexual abuse, emotional abuse, neglect, or economic abuse. In physical abuse, you look for symptoms such as shaken baby syndromes. You look for signs of battering such as bruises, scars, burns, wounds in various stages of healing, particularly around face, chest, head, arms, abdomen, back, buttocks, and genitalia. Box 28.3 presents some problems of victims of abuse in the emergency department. What do you see? In emergency department, like bleeding injuries, internal injuries, back injuries, broken or fractured jaw, perforated eardrum, talk of having problems with husband or son, repeated visits with new complaints, bruises of various ages and specific shapes, like in the shape of fingers or belt, signs of stress due to family violence, injuries in a pregnant woman, recurrent visits for injuries attributed to being accident prone. These are some signs of violence or physical abuse. And then look for sexual abuse symptoms. Sexualized behavior is one of the most common symptoms of sexual abuse in children. The younger children may have more knowledge about sexuality, and they may draw sexually explicit images and demonstrate sexual aggression. Another clue is when child acts out sexual interactions in play, for example with a doll. Masturbation may be excessive in sexually abused children. Sexual promiscuity in older children is one of the symptoms of sexual abuse. Children can also exhibit PTSD symptoms such as nightmares, somatic complaints, feelings of guilt. Children or even adults can have anxiety, suicide, aggression, chronic low self-esteem, chronic pain, obesity, substance misuse, self-mutilation. Look for signs of emotional abuse, low self-esteem, feelings of inadequacy, anxiety, withdrawal, learning difficulties, poor impulse control. Look for signs of neglect. Children or older adults appearing undernourished, dirty or poorly clothed, having inadequate medical care, lack of immunization, untreated medical or dental conditions. Look for economic abuse. The heat or electricity may be disconnected because the bill is being left unpaid. The victim is not able to pursue education or find a job. In children, one important sign is shaken baby syndrome. Okay, that is any bruises on an infant younger than 6 months of age is considered suspicious. And shaken baby syndrome is when you shake the baby and the injuries are resulted because of the brain moving in the opposite direction in the baby's head. The children who may have been shaken may have respiratory problems, bulging fontanelles, retinal hemorrhages, CNS damage resulting in seizures, vomiting, and coma. This is common in children younger than 2 years of age. When the baby is crying, you shake the baby repeatedly and can cause shaken baby syndrome. Moving on to looking at levels of anxiety and coping responses. What kind of anxiety they have there? Is it mild, moderate, or panic level of anxiety? And how we can establish safety and how we can stabilize the patient. And look for coping resources. What are the past coping mechanisms that they utilize? What are the coping or social support system they have? What are the family coping patterns? avoid judgmental tone, question about memories of early family relationships. Box 28.4 is a useful guide for assessing the risk of child and older adult abuse in the home. It says about for a child, what are the factors to assess during a home visit for a child and for an older adult. And look for support system. Look for suicide potential. Suicide attempt may be the presenting problem in the emergency department. With sensitive questions, we can elicit the history of violence. Look for homicide potential. When working with an abused spouse, ask whether the patient feels safe going home and whether a safety plan is in place for when the violence recurs. What are some factors that place a vulnerable person at greater risk for homicide at home? Presence of gun in the home, alcohol or drug misuse, history of violence on part of the perpetrator in other situations, extreme jealousy and obsessiveness on the part of the perpetrator. So the perpetrator of violence may eventually become the victim. Therefore, always ask the individuals victimized by violence if they have ever felt like killing the perpetrator. If yes, ask whether they have the means to do so. If the answer is yes, the intervention is required. Then look at the drug and alcohol use history. The alcohol, it inhibits your responses, it inhibits your thinking ability. Okay, person experiencing violence may self-medicate with alcohol or other drugs as a way of escaping in intolerable situations. It can increase your homicide potential. It can also cause other issues. So the patient provide appropriate treatment referral for a patient who has drug and alcohol abuse. And patient should not be discharged to the abuser. And maintain accurate records for all of this. So what are some questions you should ask Adam? So ask the child directly but in a non-threatening manner if someone close to him or her has caused the injury. Tell me about what happened to you. What happens when you do something wrong? And ask specific questions such as, when was the last time it happened? How often does it happen? In what ways are you hurt? So these are some questions you should ask Adam to gain more information about what's happening with Adam. So what are some possible nursing diagnoses and outcomes you are looking at? So the possible nursing and diagnoses include risk for violence, other directed or self-directed, risk for suicide, pain, risk for infection, rape trauma syndrome, anxiety, fear, hopelessness, powerlessness, situational chronic low self-esteem, ineffective individual coping, dysfunctional family process, impaired parenting, disabled family coping, caregiver role strain, ineffective role performance are some nursing diagnoses that we can utilize for victims and perpetrators. And so what are some specific outcomes that you can establish? Physical abuse has ceased, emotional abuse has ceased, sexual abuse has ceased, financial exploitation has ceased. Your interventions has to be addressed at all these nursing diagnoses with the goal of specific outcomes. Other objectives of the chapter is write out a safety plan for a victim of intimate partner abuse, discuss the legal and ethical responsibilities of nurses when working with families experiencing violence, compare and contrast primary, secondary, and tertiary levels of intervention, giving 2 examples of intervention for each level. So planning, the guidelines are developed by Joint Commission. Most hospitals and community centers have protocols, and the Nursing Network on Violence Against Women have guidelines as well. There's a general tolerance of violence in America and must be addressed if long-lasting changes are to be made. So nurses are often the first point of contact for people experiencing abuse, and so it's an ideal position to contribute to prevention, detection, and effective intervention. So whenever possible, we need to take the best interest of the patient, and the plan must be discussed with the patient, and the planning also should take into consideration the needs of the abuser if they are motivated to learning alternatives to abuse and violence. In case of child abuse, usually the child is being removed from the home, but in case of elder abuse or intimate partner abuse, the usually interventions are performed in the community. Moving on to the implementation phase, nurses are legally mandated to report abuse, suspected or actual cases of child and vulnerable adult abuse. Encourage, along with the patient, develop a safety plan. Tell to the abused person that no one deserves to be hit. It was not your fault. In case management, nurses involved in case management have the opportunity to coordinate other social and community services and provide comprehensive assistance to families in crisis, and promote community support and promote self-care activities, give a safe environment or therapeutic milieu for the patient, and health teaching and health promotion. So in this case, we identify who are the perpetrators, or who are what are some characteristics of perpetrators. So these possible perpetrators has to be targeted, or primary interventions has to be targeted to prevent abuse in the future. So nurses who work in maternity unit are often in a position to identify these risk factors for abuse in case of new parents, and they have to initiate appropriate interventions or educational interventions. So usually parents or teenage parents or new parents whose behavior towards the infant is rejecting or hostile, these nurses can identify some risk factors, and these patients has to be or these parents has to be educated to prevent abuse in the future. As a nurse, our observation is important. A community health nurse or as an emergency department nurse or a psychiatric mental health nurse, you identify these indicators of abuse and then initiate conversations with the patient and have all these community resources available for this patient safety to bring about a safe environment for the patient is important. It is a duty as a nurse. It is your duty as a nurse. So in the end, you do suspect a child abuse in Adam's case. So what important documentation is required? You need to have verbatim statements of who caused the injury and when it occurred, a body map to indicate the size, color, shape, areas, and types of injuries with explanation. So this will give you an important documentation about how you suspected the child abuse. So moving on to the prevention of abuse. So there is primary prevention, secondary prevention, and tertiary prevention. So the primary prevention is measures taken to prevent the occurrence of abuse. For example, your strategies such as reducing the stress, increasing social support of new mothers, increasing coping skills, increasing self-esteem of possible perpetrators. That is how you prevent, a primary prevention. Whereas secondary prevention is early diagnosis and treatment. That is, you identify there is abusive situation and you put early intervention to minimize their disabling or long-term effects. Here, for example, you medically treat the injuries, screening for individuals at risk, providing supportive therapy, support groups, pharmacotherapy, and contact information for community resources. Be providing a caregiver or helping with housekeeping, or having some resources for patient to deal with caregiver if they have an elderly caregiver, having some alternative resources to help with that situation. So that is secondary prevention. Whereas in tertiary prevention, we are facilitating healing and rehabilitative process. For example, we are counseling individuals and families and providing support for survivors or assisting survivors of violence to achieve their optimum level of safety, health, and well-being. So one example is legal advocacy programs for survivors of intimate partner violence are examples of tertiary prevention. So remembering Adam's situation, you decide you want to help prevent child abuse in the community and plan to hold classes for new parents. So what are some topics that should be covered? We must educate about reducing stress, reducing the influence of risk factors. Here in case the Adam has some learning disabilities. So identify some community resources that deal with such situations. So increasing social support, increasing coping skills, increasing self-esteem, and finally connecting the parents to appropriate resources for help. Maybe a mother's morning hour program or Little Lambs have some facilities where the patients can share or the parents can share the difficulties and get resources for help with the child. So what are some advanced practice interventions that can be implemented? That includes individual psychotherapy, family psychotherapy, and group psychotherapy. So here Adam admits, I don't have a skateboard and I didn't fall off anything else either. He agrees to tell you what happened as long as you keep it a secret. What should you do? Agree to keep the child's secret to build trust. Ask the child's parent to explain what happened. Report the suspected abuse to child care services. Have the child talk to another victim of child abuse. Here, report the suspected abuse to child care services would be most appropriate because you cannot keep it as a secret. Because as nurses, we are legally mandated to report child abuse. So looking at this one, child abuse perpetrators are most often extended family members, child care workers, the child parents, and strangers. As we mentioned earlier, the child's parents are often, in most of the cases, at least 80% of the cases, the child abuse perpetrators are the child's parents. Finally, should nurses be legally mandated to report intimate partner abuse? The reporting requirements would vary from state to state. Nurses are legally mandated to report child abuse and vulnerable adult abuse. So it is yes or no. And we may have to look at the Indiana state law to see if we are legally mandated. But for most of one, I would believe we are legally mandated to report intimate partner violence. So this was the abuse assessment screen that we mentioned earlier. So it has 5 questions. So within the last year, have you ever been hit, slapped, kicked, or otherwise physically hurt by someone? Since you've been pregnant, have been hit, slapped, kicked, or otherwise physically hurt by someone? Within the last year, has anyone forced you to have sexual activities? Have you ever been emotionally or physically abused by your partner or someone important to you? Are you afraid your partner or anyone listed above? So these are the abuse screening question, abuse assessment screening question that you can utilize. Thank you.